Hello folks, welcome back. This is Kweku. I am a pharmacist. On this channel, I talk about healthcare and pharmacy related stuff. And if you're watching this, I guess I can safely assume that you find such information beneficial. So go ahead and hit the subscribe button so you don't miss out on content as and when it is released. Today, I will briefly be talking about the medication amlodipine. I'll be taking a look at what it is, its uses, the side effects, and the precautions or warnings for anybody that is on it or anybody that is considering it. Just a little disclaimer before we start. This video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. Please continue to follow any specific instructions provided to you by your local healthcare provider or providers. Amlodipine belongs to a class of medications called calcium channel blockers. Calcium channel blockers exert their effect primarily by causing a dilation of the blood vessels, precisely the arteries. A dilation in the arteries ultimately results in less resistance to blood flow. This reduced resistance to blood flow caused by dilation of the arteries is ultimately what leads to lowering of the blood pressure. Hence, it's used in the treatment of hypertension. In angina or heart pain, as some people call it, there is reduced oxygen supply to the heart muscles. This may be due to a reduced supply of blood to these muscles. This ultimately results in the pain that is felt in the heart. Amlodipine helps in the resolution of this issue by causing a dilation of the arteries that actually supply the heart muscles. With dilation of the arteries that supply the heart means that more oxygen-rich blood is made available to the heart muscles, leading in most instances to the resolution of the pain. Now let's take a look at some of the common side effects. Edema or fluid retention, which typically manifests in the form of swollen ankles, is by far the most common side effect that is experienced. It tends to be dose related. That means that the higher your dose, the greater the probability or the greater the risk of you developing fluid retention. Studies also show that this side effect tends to be more prevalent in women relative to men. Other side effects include headache, dizziness, and for that reason, it will be good to know how your body reacts to it before doing anything that requires coordination, fatigue, nausea, abdominal pain, and in some instances, even erectile dysfunction. And like I always say about erectile dysfunction, uncontrolled high blood pressure is in itself a risk factor for erectile dysfunction. So discontinuing your amlodipine or not taking anything is actually not a solution. In my opinion, the best way to approach it is to have a discussion with your doctor for an alternative to be found, because otherwise you're going to end up in the same place anyway if you have uncontrolled high blood pressure. Now we will switch our attention to some of the precautions. The first on the list is people with liver disease. Amlodipine should generally be used with caution with people with a history of liver disease. For such people, a dose adjustment may be required, or sometimes if even their dose needs to be increased, it may be slowly titrated upwards. That's because the elimination of amlodipine is actually slower in such people, and we risk having high concentrations of amlodipine in the system just because their body is not really getting rid of the amlodipine fast enough. Caution should also be exercised in people with obstructive coronary artery disease. While amlodipine is used in the treatment of angina, in such people, there is an increased risk of the angina actually worsening, either at the start of the medication or sometimes when the dose is increased. In very severe cases, it may even lead to a heart attack. So for such people, if amlodipine is really necessary, they really need to be followed up by their doctor and they need to be monitored just to make sure that things are not getting worse rather than improving. All in all, amlodipine is a very safe medication. It is very widely used especially for the treatment of hypertension. As a matter of fact, over the last couple of years, amlodipine has always been in the top 5 or at worst the top 10 highest selling drugs every year. As always, thank you for staying through. Don't forget to subscribe and do not discontinue any medication without letting your doctor know about it first. Thank you so much.